Democratic lawmakers say Medicaid cuts in the GOP budget law, that One Big Beautiful Bill Act, are actually impacting health care. One hospital in North Georgia announcing just last week they're ending services for delivering mothers and newborn babies. As WSTV's Sarah Smith reports, hospitals in our area aren't taking drastic measures, but they are considering the impacts.
Evans Memorial Hospital in Claxton is a perfect example of thriving rural healthcare, but with recent Medicaid cuts, CEO Bill Lee tells me that hospitals across the state, just like this one, are taking a closer look at potential impacts on services.
Access is priority. So what can we do to ensure that we have access to care?
It's a question many rural hospitals and healthcare facilities are asking as Medicaid and DSH cuts loom from the One Big Beautiful Bill Act.
Like every other rural hospital in the state of Georgia, we're all trying to be smart and look at what we can sustain and what we can't sustain long term.
Bill Lee, CEO of Evans Memorial Hospital, tells me no drastic measures are being taken at this time, but they're preparing. For example, $3.3 million could be cut from the hospital's budget. As far as services, Lee says the intensive care unit costs the most for patients. While it's important for the community, the ICU also impacts the facility's bottom line, and it would be the first on the chopping block.
Knowing that the unknown, the uncertainty with future cuts with regards to Medicaid, with other funding streams, with the potential changes in perhaps unemployment and underinsured, all of those things factor into the equation in which we think about how can we sustain programs like our intensive care unit.
That closure could be detrimental for the almost 30,000 people in their service area. The closest ICU is about a 30-minute drive. Leaders like U.S. Senator John Ossoff say supporting rural health care is a matter of life and death.
It's not a mystery that in a flourishing society, the means of achieving health and long life are a right accessible to all, and not just to those who live in the right place or have the means.
States have the opportunity to apply for funding through the Rural Health Transformation Fund. Lee tells me that he's working with state and local officials to make sure that Evans Memorial is represented and considered for that funding. Reporting in Claxton, I'm Sarah Smith, WSAV News 3, on your side.